Well, hello everyone. How is it going this Tuesday? I said Tuesday, weird. Tuesday. I just got off the set like I always do, but this was like really crunch time, and we didn't end until 6:30. So I'm glad to be here, and I'm glad to be talking about something that's very important. So we started this series for the month on mental health, and one of the things that really affects so many women and also men. We're talking about parents when they suffer from postpartum depression. And it's something that isn't talked about as much. I would say that, like my parents' generation and grandparents and all that, it's not that it wasn't there. I just don't think it was talked up about that much. And so we're really trying to break the stigma there and talk about it. And I think after doing this story, I might have had this as well, but I didn't know about it. And I just kind of was going through the motions. But the depression, the anxiety that you experience after having a child is what postpartum depression is. And we did a whole story, and there's all these resources. So I do encourage you to go to our website, fox26houston.com, and look at all of those, because one of the things that we're dealing with now post pandemic is the wait lists and to see therapists. And so that's why I have someone who is an expert at this, and she does so many things, and I'm going to introduce her in just a minute. But I did want to let all of you know, if you want to comment, you have any questions for her, please let us know. I know that this affects so many people, and it's not embarrassing. You're not alone. And that's really the message that we want to get across. And it's something, when I had my first Ryan at 6 years ago, I thought I was all alone. I'm like, what is going on? And so I can really relate. So let me go ahead and bring in Leslie Murphy. Thank you for being here today.
Hey, Rashi, it's good to see you again.
Yes. So first off, tell me about how often you see patients who are dealing with postpartum.
Well, a lot of times we're getting referrals from, sometimes it's the spouse who's recognizing, gosh, my wife is really struggling, or she's crying, or he's concerned about her. Sometimes referrals may come from the OB-GYN, it may come from the patient's mother. So we get referrals from all sorts of support or physicians. And so a lot of times I'm thinking about what you just said about how you're looking back going, maybe I had a little bit of this. And so we hear that a lot. And so I think that patients are, coming in, maybe they're nervous. They don't really know what to expect, but they're sharing that they're having different symptoms of feeling sadness that they can't explain. They're feeling a sense of loss. They're feeling anxious, just a whole host of symptoms.
And also, what I found, we did a story together, which aired last night, and you were telling me how fathers also experience this. So tell me about that.
Sure. So especially for our moms that are experiencing some postpartum, we see that about 50% of those partners will also struggle with some postpartum symptoms, whether that's depression or anxiety. So again, he's already worried. Life has changed for him, whether they've added a baby or this is their first. And so he's maybe focused on finances and changes in schedules. But now he's got a wife that he's like, who's acting maybe not that he thought, how he thought she might. He thought she might be so excited and happy, and maybe she's tearful and she's not sleeping, or she's anxious and having, a lot of intrusive thoughts. And so we see this with the guys, but just like you said, a lot of them don't even understand that that's what's happening to them. So although we may see a woman come in by herself for counseling, I think it's really important that we can help include that husband at least at one session to check in on him, and also look at ways that he can both support her, but also make sure he's getting the support that he needs as well.
Okay. And what do you think about people who are reaching out online to get some of that support?
Oh, I think it's great. You mentioned about the wait list, and we're seeing it both in my practice and just across with all of my colleagues. There's been a long list, and so I do think that being able to get in. And I think telehealth has just offered, like you said, during COVID, it's just opened up where it used to be, oh, if I'm out of town or if I'm unable to get to the office due to medical issues. Now it's really become just part of most clinicians' practice. And so it's just a way for, especially for a new mom who's recovering from surgery or recovering from delivery, she's got a newborn, maybe she doesn't have a babysitter, or maybe she is
Mhm.
not comfortable bringing her newborn to the office. It's a great way for women and men or couples to be able to participate, especially if they've been away. Maybe the baby's been in the NICU. Maybe the dad's been out of work tending to his wife because she's been afraid to stay by herself. And so it's
Mhm.
a great way that they can still, attend work or be at home with the baby and also get some counseling.
Yes, definitely. And there's so many single moms out there or single dads that are doing it all. And so
Absolutely.
definitely getting that help is huge. And Leslie, I wanted to show Laura. This is Laura Simon, who I spoke with yesterday,
Yeah.
and she has I mean, she had a therapist. She didn't realize that she was um, experiencing postpartum, but her friend said, you may want to talk to your doctor. Doctor recommended some medication. She didn't want to go that route, so she decided to talk to a therapist and also talk about her journey online. And she said, one of the great things is that she's vulnerable and she opens up, but it's some of the best therapy because there's so many great messages coming towards her and so many people who are coming and saying, I'm going through this too. And so it's kind of like she was talking about, you know, I know your children are older, but mine are, I'm more closer to the remembering, I guess, part of the what happens right after birth kind of thing. But you kind of don't remember all of it, like the feelings.
Right.
And so connecting with people who are going through it at the time right now, and also the situation the world is in, like when the pandemic was happening and I had my second daughter and I'm like, what is going on? Nobody really understands. And it's like, is my husband going to be in there? Is it? So I really, and even I would tell you, like, as a parent myself, I follow a lot of and have connected with many moms
Mhm.
that have kids my age too, just dealing with whatever is going on with school or how to handle certain things. And so I think that tool has really, really helped parents in all aspects and really people in other professions as well. I'm sure it's helped you too.
Absolutely. And I think, like you said, it's not just, I mean, of course, we're talking about new moms and
Right.
postpartum. But yeah, no, I think telehealth is just, I think it's here to stay. I think people
Hmm.
thought, oh, it's just here during COVID and it'll go back to being in person. And we have people that do prefer. And I always offer for my new moms that they can come and bring their babies. They can come and breastfeed, whatever they're comfortable with in the office. And it's not very crowded, so they feel safer. But there are others that just, they're not able to drive yet because of their
Hmm.
or for all the other reasons I mentioned, that they're just more comfortable. And then a lot of times, if they can develop that rapport with a counselor, they may, like we talked about yesterday, there's a lot of success in treatment for postpartum depression and anxiety. So they may just, get better and move forward, but there may be
Hmm.
another hiccup in their life. There may be another thing that comes up about returning to work or having a second child. So it's kind of nice then to be able to have that continuum with that relationship with that therapist so that they kind of have them through the kind of pitfalls of parenting.
Yes. And I would also want to bring up the fact that dealing with these thoughts and feelings is so crucial. It's almost as crucial as feeding your baby because, well, you can say because you can finish that. You finish that. You know what you're talking about.
No, no. Well, and I'm going to go back to the patient that you talked to, and and she's done such a great job of showing and kind of talking about what's been helpful for her. And she mentioned, I think, with you that she really wanted to focus more on more of a natural method. So I think we have a lot of women who are nervous to go on medication. They hear psychiatrists, they hear
Mhm.
SSRI or psychotropic meds, and that can be kind of scary. So, while that can be really helpful, going back to what you said about the things that this is kind of, some basic needs. So, is she hydrated? Is she eating enough? Is she getting enough rest? Does she have that social support? Is she getting some sunshine? Is she able to walk outside or be around other people? So I think, yes, I think it's just as important as feeding your baby as much as, am I enjoying my baby?
Mhm.
Um, am I feeling confident as a mom? Am I laying down to rest when she lays down for a nap? I mean, so all of those things are just as important as, the other part of taking care of your child. It's a really
And
big,
something that you said yesterday, which really resonated with me, was
yeah,
in terms of trying to figure out if you are, needing to seek help or not, is if you're having these feelings, sometimes you chalk it up to, okay, well, I'm tired because, and I'm sad because I've, haven't had a break, or because I'm not hungry because I was breastfeeding and this and that, whatever. But it's the time when your baby is asleep and you think to yourself, wait, I don't want to go to sleep because I'm so sad, or I'm still crying because I don't know why, or those type of questions. That's what Laura was explaining as well.
yeah. Well, and I mean, if you think about it, if you're really tired, at any point during that first year, right? But you're really tired, and so the baby's asleep and everyone's asleep, and there's not a reason
Right.
that you're up, but
Mm-hmm.
your brain won't turn off. Those
Mm-hmm.
thoughts are, I call it the 610 loop, right? Those
Yeah.
thoughts are just going, 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 and and then there's a lot of just frustration. Well, why am I doing that? I need to sleep. And then it kind of spirals.
Mm-hmm.
So
Mm-hmm.
that's just a sign right there of, wait a minute, what's going on? Why can't I quiet my brain? Why can't I sleep when I know I need to? Um,
Mm-hmm.
so that's a great way to be able to, or a sign to be able to say, what, maybe if I talk to someone, I can problem solve or talk, learn some what we call CBT, cognitive behavioral therapy, which is a way to kind of process those thoughts. I call it being on the 610 loop and finding an exit. How do we find an exit? So
Right.
kind of reframing those thoughts. Um, Again, of course, medication, but also just um, nutrition and
Mm-hmm.
all that good stuff too.
Yeah. There were a list of some resources, which we've also put on our website.
Awesome.
And one of the things, like you just said, you have been referred to by pediatricians or your obstetrician gynecologist. So that really is one of the first places you say is the best place to go to when you think you need help.
Absolutely. I think, even if you're past your 6-week follow-up, if you are experiencing some sadness that has been just stayed with you for over 2 weeks, if you're having um, fearful thoughts, if you're having what we call intrusive thoughts and anxiety, then absolutely your OB-GYN is a great place to start. Most of our patients don't have a psychiatrist they've been seeing for years. And so that
Mhm.
whole idea is new, or even a therapist. Or maybe they have a therapist, but maybe he or she is not, trained or familiar as much with postpartum depression and anxiety. So that's a great place to start, and start back with the OB-GYN. The pediatrician is another great resource. Being able to go to some of those major hospitals and just ask for the social work department. Hey,
Mhm.
I know that Women's has this great list they give out of all kinds of resources. There's a couple of clinics and people in town that are like myself, that are trained in this and really can provide the support or even the resources. One of the things you have up there that we've talked about is through Texas Children's, the Pavilion for Women.
Mhm.
And they have really one of the few places in Texas where it is what we call reproductive psychiatry. And these clinicians are trained in all things reproductive. So that's going to be infertility or pregnancy loss, NICU, and of course postpartum. And so they're trained in that. So they're familiar with what's safe for the body, what's safe with breastfeeding as far as medication. And a lot of times, Rashi, women will start on maybe an antidepressant, anti-anxiety medication, and then with the help of therapy and support group, then within a month she's feeling better. Within a few months she may be weaning off medication. So it certainly doesn't have to be this long-term, 6-month, 2-year battle.
Mhm.
The earlier and the quicker that she or her husband can get some help, really is going to be. Oh, and this is the Postpartum Support International, PSI. They are really just the guru of postpartum. They have so many support groups. You can text and call to any hotline. And that's really nice because I think a lot of our moms do feel alone. And so maybe their husband or their partner's off at work and they're feeling alone. So just being able to reach out and just talk live to someone, just to say, oh my gosh, I'm feeling alone, or I'm feeling overwhelmed, or I just need to talk to someone. And that can be so, so helpful. I think I shared with you yesterday, I called my neighbor and said, come over and help me feed the baby. And it really, if we can just stress that today about don't be afraid to ask for help. Don't shy away. It's out there. If you ask, there's so much out there. And, whoever that is, whatever source that comes from.
Definitely. No, I think that that's so important. And I did want to bring up also your website. I'm going to try to play this right here, see if it works.
Okay. Oh, yeah.
Yeah. So if you want to just talk about your website.
Absolutely. So my specialty is women's health. I worked at Women's Hospital for years, and I've been in private practice since then for about 15, 16 years. So I have 2 offices. I work with fertility practices, and I also have my own private practice. And so I see really almost, I say, all ages and stages. So everything from I'm single thinking about freezing my eggs and now I'm married and I'm trying to get pregnant, to I may have some postpartum, I've got parenting issues, I'm going back to work. My kids are driving me crazy. They're teenagers, or we're potty training. So it's just really across the span. And it's great. And I've got an associate, Kristen, who's joined the practice, and both our offices are in the Memorial area. So, and we also do telehealth. So, happy to talk with anyone or answer questions or make referrals, whatever what we need to do.
No, that's great. And I also wanted to ask, as we kind of close this conversation for now, because I do hope that we do more stories together, because I know you do so many other things. When it comes to mental health, what do you think is the number one sort of hurdle that people go through in order to get that help that they need?
We were just talking about this last week, how COVID is really one gift of COVID, right? Has opened where so many people needed support, and it wasn't just this, oh, I'm going to go talk to a therapist. It was necessity, right? It was a coping, but it opened the door, and it almost has normalized it for so many, which has been a blessing, a wonderful thing. But what that's done is it's made it so popular that really the biggest hurdle, I think, right now, are that just how busy all clinicians are. Every practice, whether there's a wait list or they're not taking new patients. So that is probably, I would say, kind of the biggest hurdle. And I was at a mom's thing a couple of weeks ago, and I think every mom I talked to there was either herself or her daughter was seeing somebody, or they were looking for somebody. And on one hand, I think that's wonderful, right? That people are embracing and getting help and doing, psychotherapy or talk therapy or whatever it is that they're looking for. But it also says, gosh, we're a nation that's struggling. So, it's kind of bittersweet. That makes sense.
Yeah, definitely. And I'm glad that people are at least like, identifying that they need or someone needs that help, because it's not being brushed under the rug, which is,
Absolutely. And I don't want to give the impression that, okay, well, everyone's book, don't call.
yeah, right.
There is help out there. And so,
Yes.
and I'm happy if people want to reach out or email or whatever, um, happy to make referrals or get people plugged in, where
Mhm.
they might need to go.
And that's the other thing, is it's not just about maybe you can't help, but maybe somebody that can. And
Oh,
so
all the
it's
time.
all connected. Everybody knows everybody in this industry there. So
Right? We do.
yeah.
Absolutely.
Well, thank you so much, Leslie, for taking the time to talk to us. I know it's so beneficial for all of our viewers and Facebook followers, either on YouTube or on our website, to get this insight from an expert and know what's going on with people who are seeking that help, what they can expect, all these things. So I hope to continue to bring some more of those stories to you. So until next week, we hope you have a great week, and I'll see you next time.